If the state of Utah's legislature cannot fund something that is, I consider, essential services for the citizens of the state of Utah, then there's a problem.
4 years ago, Utahns voted on the ballot to adopt Medicaid expansion. The feds pay for 90% of the costs and the state pays a tenth. But a new bill is moving forward that could cut services if there's a shortfall. I'm Emily Tenser with Fox 13 News Utah. This bill took up an hour and a half of discussion at Thursday morning's meeting, and the sponsor described it as a planning ahead doomsday scenario bill, but those in opposition say it hurts those who need it the most. Approximately 120,000 Utah adults are eligible for Medicaid expansion. That's an estimate from the state DHHS, and some of those services could get cut under Representative Brady Brammer's proposed bill.
Now, this is not meant to cut Medicaid when there are not problems. It does not do that.
It would only happen if there's a Medicaid shortfall, which Brammer explained in this list before fellow lawmakers.
Now, it would be a drop in FMAP of more than 2% in 1 year and 4% in 3 years.
The FMAP is a federal medical assistance percentage that shows the amount of federal matching funds for certain state expenditures. If that goes down, there's an order of what goes first.
Each of these is scary in its own right, and they're blunt. But the point is, it creates that waterfall, and then it doesn't automatically implement them.
Only one spoke in favor of the bill.
The biggest problem we foresee coming for the budget of Utah, which drives all of our taxation policies, is exactly what we're talking about today.
Meanwhile, over a dozen health activists and Medicaid patients expressed their concerns.
This is a program that deals with human beings, human health, human lives.
We have roughly $400 million sitting in a reserve account right now for this very scenario that I think Representative Brammer is trying to address.
People who have rare diseases were the first ones to get cut under the language of the bill currently.
That's Jan Curran, who initially had no insurance when diagnosed with cancer.
Medicaid coverage saved my life.
Despite hearing mostly opposition, representatives voted the bill moves forward 10-4.
I would rather have specific guardrails put in place instead of it being a bloodbath up here in a political process.
Another critique brought up by the bill's opponents, this was decided by the House Business and Labor Committee and not a Health and Human Services Committee. Reporting in the State Capitol building, Emily Tenser, Fox 13 News, Utah.